Hospitalizations continue to rise in the Bay State due to the Omicron variant. Western Mass News checked in with local hospitals to see how many of those in the hospital are vaccinated. Tonight, we're getting answers from Mercy Medical Center and Cooley Dickinson Hospital. The vast majority of COVID-19 hospitalizations at Mercy Medical Center are those who are unvaccinated or not fully vaccinated. Chief Medical Officer at Mercy, Dr. Robert Roos, tells Western Mass News that's 80% of patients.
Right now, what we're seeing is a little bit of a dichotomy in that we're seeing younger people that are unvaccinated, occasionally developing severe illness that requires hospitalization. When I say younger, I mean folks in their 40s and 50s, with or without major chronic health conditions. That could be one of those individuals that gets a severe infection and ends up in the hospital needing treatment.
At Cooley Dickinson in Northampton, Medical Director of Infection Prevention, Dr. Joanne Levin, says 1/3 of their cases are unvaccinated or undervaccinated. And the remaining cases?
2/3 of our cases were people who were vaccinated but not boosted. I haven't looked particularly at the ages, but I can tell you most of the patients in the hospital who are vaccinated are here probably because they have significant underlying diseases, are elderly, and are at particularly high risk.
Now, both doctors tell us those who are vaccinated and those who have been boosted tend to have mild infections compared to those who are unvaccinated.
We have had unvaccinated patients without significant underlying disease be very sick and die.
Those who are vaccinated also are less likely to become ill, Roos says.
In fact, being vaccinated means that you're about 5 times less likely to get Omicron than if you were unvaccinated. And being vaccinated means you're about 13 times less likely to die from COVID than those that are unvaccinated.
At Mercy, there are 25 patients hospitalized with COVID, of which 2 are in critical condition. At Cooley Dickinson, as of December 27th, there are 17 patients hospitalized with the disease, and at Bay State Medical Center, there are 169 patients, of which 23 are in critical condition. As the state reports more than 993,038 cases, with a 7-day positivity rate of 9.49%, the biggest concern is the healthcare system becoming strained by the caseload.
We're already operating at a level that is approaching or at capacity, and so an onslaught of even another 10% or 15% of cases needing hospitalization could be a tipping point.
Mercy's chief medical officer says the medical field has evolved in treating COVID.
At this point in the pandemic, as a healthcare leader, hospital administrator, a public health expert and physician, I am not concerned about the management of the disease of COVID.
What concerns Dr. Roos is staffing. There is a staffing shortage with certain departments reporting an open position rate of 10 to 15%. Dr. Levin also tells us staff are fatigued. Even so, Dr. Roos remains hopeful that 2022 will be a better year.
The combination of testing, prevention, treatment, vaccination, we will get to a point, I'm optimistic, barring any major significant devastating new variant, that we will be at a point when COVID becomes endemic.
And to help with staffing shortages right now, Cooley Dickinson is among others in the state utilizing National Guard members. 2 will arrive tomorrow. Mercy Medical Center hopes to receive extra help from the Guard soon. And if you have a question or something you want us to look into for you, email us at gettinganswers@westernmassnews.com. Just be sure to include your name and phone number as we work to dig deeper.